All right, so health expenditure here in Australia, 98% of all those funds are allocated towards curative health, where only 2% is actually spent on preventative measures such as campaigns, education, vaccines, etc. Preventative health is highly cost effective, all right? So if you prevent somebody from getting sick in the first place, then you don't need a hospital bed and nurses and doctors and all of the business that goes into looking after someone who is sick. But ethically, it's really hard to shift funds away from curative health to preventative health, because if you do that, then some people who currently have sickness, disease, etc. are probably going to get worse. So it's no surprise that the rising aging population that we have in Australia, along with the rising rates of chronic disease requiring ongoing management, such as dementia and cancers, means that our current health expenditure in Australia is not sustainable. We're going to need to keep pumping more money into it, which means that taxpayers are probably going to have to pay more, or it's going to raise the cash flow rate. It's not sustainable. There are also still significant equity and access barriers despite the existence of Medicare, PBS, NDIS, etc. And we primarily see these barriers from rural and remote populations, low socioeconomic status peoples, and First Nations peoples. So what's the government doing and can do about the expenditure issue? So the government incentivises health workers to actually work in rural and remote populations, which is going to lower that barrier to access. And they also have recently increased the bulk billing incentive to triple to hopefully encourage GPs to bulk bill as opposed to charging their own private fee on top of consultation. Medicare does exist in Australia, and it is funded at a 2% taxpayer rate. So when you pay your taxes every pay, 2% goes towards Medicare. Private health insurance does exist to lower the burden on the government by offering private services, etc., through physios, private hospitals, chiropractors. And secondly, it is also an incentive for high-income earners to take private health insurance, so therefore avoiding the government system, because the government will actually charge a Medicare levy surcharge for income earners. I think it's over $105,000. Finally, the NDIS and My Aged Care programs do exist to try and keep patients at home and get care at home, as opposed to going into a hospital or an institutional or non-institutional care facility, which therefore, once again, will lower the cost of overall healthcare in Australia. And that is our too long didn't study version of health expenditure in Australia.